So while there's a number of therapies out there that address a multitude of issues, there's no cookie cutter, not one size fits all. One of the therapies I specialize in is EMDR. It stands for Eye Movement Desensitization Reprocessing, which sounds very scary and very clinical. It's not. What EMDR does is it's been researched and found very effective in resolving trauma, anxiety, many depressions. What it does is it comes from a theory that you really can heal yourself. We're geared towards that. The same way you get a scratch on your arm, what do? You clean out the debris and you heal. We can do the same thing. As a therapist, my job is just to help facilitate that process, but you really are doing the work and you can. So when a trauma happens, or there's a source of an anxiety or several anxieties, it kind of gets frozen, stuck in your system, locked in, for whatever reason. And all we do in our therapy session is to explore where that seed got planted, how that started for you. We look at what emotions it still brings up for you in the present, even though it's caused by something that happened 10 years ago, and you think, well, I dealt with it, I'm over it, but the feeling is still there. The feeling doesn't change. So we kind of spend some time exploring that, what the feeling associated with it is, what the emotional charge is still there, and what belief it creates about you. Oh, I can't succeed. I'm insignificant. I'm not safe. I can't be safe. We look at all of these things, and then the technique is actually relatively simple in that we kind of get both sides of the brain going to reprocess, to unstick this situation so that it doesn't keep affecting you in your present living. And we do that by either eye movements, asking you to just follow me as your eyes move side to side. If that's uncomfortable, there's other things. We can do tapping alternately on the palms of your hands, your knees. I have these little buzzers that you hold on to and they just vibrate alternatingly. We can use sounds. So the sound will go in each ear alternatingly. Number of methods so that you're as comfortable as possible. And relatively quickly, a couple of sessions, for some people, less than a couple, depends on the issue. Suddenly, that incident that when you still think about it bugs you doesn't hold the charge anymore. It doesn't rewrite history. No, that was a bad time. That was a bad situation. But you gain this perspective where it's in the past and you can reflect on it and get what information is useful to you about it. Like, well, I didn't handle that so bad. It wasn't my fault. I get it. I did the best I could there. And it stops getting triggered and affecting you in the present.
We believe that mental health treatment is good for everyone and that you can benefit by coming in and speaking to one of our highly trained clinicians. We do not believe that anybody should suffer in isolation.
Now, as an adult, I now know this. When I got older, I know the story. My parents tried. There was a cake. The cake got ruined. They scrambled to get another one. They couldn't do it in time.